Good evening. We are now in the midst of a new pandemic.
One local health official say is a pandemic of the unvaccinated. On Tuesday, Sanford Health said that 87% of its patients in the hospital due to COVID are unvaccinated.
Avera says it's also seen an increase in coronavirus patients, most of whom are also unvaccinated.
It is so clear as we look at who's being admitted every day.
Health professionals at both Avera and Sanford say 80 to 90% of their COVID-19 patients are those who did not get the vaccine.
There's two populations we're seeing, and the vast majority of them that are being admitted to the hospital, and especially the ICU, are unvaccinated.
But the needle hasn't moved much for those getting the shot. According to the CDC, more than 50% of all South Dakotans have completed their COVID-19 vaccinations.
And whether that's because of health reasons, they're not convinced of the safety or the efficacy of this vaccine, or whether it's because of political reasons or otherwise, that's not up for me to say. But I will say from the standpoint of the vaccine, we can say for sure that it is safe, that it is effective, and that it will prevent you from ending up in the hospital or dying from COVID.
The good news, doctors say, is we haven't seen the surge in COVID cases they were anticipating, which begs the question, have we peaked?
We don't think we've hit it quite yet. We expect it right about the turn of the month.
Cases have leveled off just a little bit for us over the last week or so, but as we look last year, kind of early October, late September, we had a little bit of a leveling off, but then we took back up again.
When it comes to the booster shot, not everyone needs it right now, just those who are immunocompromised or immunosuppressed.
We are still not able to give booster vaccines to the general public that, say, got vaccinated 6 months ago or 9 months ago. The FDA is meeting on that late this week, and then probably the CDC after that, and so we hope to hear more on what's going to be approved.
And both doctors say even if you've had COVID, you should still get the vaccine because then you will have something they call super immunity.